it might persist. So normal mature swallow, how is it? It shows a positioning of the tongue high on the palate. So now you want to close the palate. So your tongue will become like a roof and it will touch the palate, the roof of the palate, and give a good closure so that the back of the posterior part of the tongue can move backward and throw your bolus bit back. So this is help with the maxillary incisors and lip and cheek activity to push the teeth forward. And till now, this was what orthodontically it was managed. Before this myofunctional therapy started, this is how it was taken care of. So if you see, there's an appliance put near the tongue, and the tongue is restricted from moving forward, which is kind of uncomfortable for us. And this do not extend our practices beyond the tongue or the palate. But this is where you really need to see the breathing pattern of the child also, because this is something which will help you to understand what exactly is the baseline problem of the child. So do not ignore it. I will not, and came to know that this is a generic term. Oral motor therapy is an umbrella term where oromyofunctional therapy is one aspect. So it's a larger thing is oral motor therapy, which focus on appropriate breathing pattern, exercise of the tongue. Then there are very, very funny exercises also, like monkey face exercise. So swallow. What is happening? I am developing a good swallowing pattern where I am taking away the reflex, infantile reflex is taken care of. And now the child puts the tongue upward, which is a mature swallowing pattern. What happens is if you are standing, many times what happens, the child is sitting and the therapist is standing behind. The child can't see you. So don't use that posture. He has to see you as well as him or her to adequately get the model. That's one thing. Okay. Awareness initiated about these disorders and management protocols has to be designed accordingly. So this is how I wanted to share from my presentation today. Any discussions are welcome.
That was wonderful. That was so wonderful, because you specifically said you do it non-instrumental so that all of us can do it in the clinic. And that is such wonderful sharing for all of us. Ma'am, I have two questions, comments kind of things.
Yes, so when you were talking, discuss that you can use it in sleep disorders, sleep apnea. Okay. You can use it in tinnitus management. You can use it in TMG joint dysfunctions. You can use in articulation disorders. You can use it in ankyloglossia. You can use it in post-frenotomy, where your frenulum has been removed. Many things are there. The scope of practice is actually increasing day by day.
It's quite huge, actually.
In Down syndrome, there's a condition. There's a neurological condition, but still it helps.
Yes, ma'am, because they do have strawberry tongue, they have protrusion, like you said, they have recurrent ear infections. So even when you are training with basic lip posture also, the child has mouth breathing and has constant cough and cold. The child is going to have mouth breathing. They cannot keep the mouth closed for the purpose of better posture also. Plus they have hypotonia. So even if you get them to sit like, they are going to